guys, Dr. Kristie Ennis, physical therapist, pelvic floor specialist, certified strength and conditioning specialist, and nutritionist. And today I'm going to go over a Kegel exercise beginner's workout. It's a mouthful, but what does that mean? So Kegel are really the pelvic floor muscles, and these are super duper important. They're muscles we don't think a lot about, but really important for a few different reasons. Number one, they help hold things in. And those things would be urine, gas, stool. So when those are working properly, that really helps keep things lifted and up. Number two, it's actually part of our core stabilizers. Most people don't think about that, but these muscles attach into part of the spine. And without them working, you can get hip pain, back pain, butt pain, all sorts of pain. So it's important that they are working in order to help stabilize that spine. And they also help to stabilize as far as posture goes too. So they're postural muscles, so they help us all look really nice and pretty in our positions. And then lastly, and this is something that most people really care about, they actually help with erection and they help with orgasm. So the stronger those muscles are, the better those things are. So if you weren't listening before, you might want to listen now, because usually those things are important to people too. But all of that is why it's really important to know how the heck do you do these. And the majority of people I talk to are not activating these muscles properly. So first things first is figuring out where the heck they are, because you can't really see them, right? You see your bicep, can't see those things. So I usually start people getting a towel, just rolling it up. You can set it on your seat. You do not have to do it with a towel. You can certainly just sit. But then you're sitting on it, you get a little feedback from that towel. So you want to think about your pelvic floor like a clock. So 12 o'clock is the pubic bone, 6 o'clock is that tailbone, and then 3 and 9 are your sit bones. And then the pelvic floor is in between there. So you can kind of go from side to side to a little pelvic tilting to figure out where the heck that might be, okay? Now, number two, once you kind of have that in your mind, you want to know that these deep abdominal muscles, called your transverse abdominal muscles, work at the same time as those pelvic floor muscles. So it's important to get them to work together properly, okay? So when you're thinking about the transverse abdominis, the way to get that to work, you take a breath in, fill the belly up, exhale, and then that belly pulls in. You can think about even just trying to pull that belly button in gently, but I always have people on their rib cage, because this is a lot of times what I see. And that's not doing much for you, okay? So you don't want that rib cage to move. It's just that tiny motion. And you're not doing a pelvic tilt at the same time, or you're not activating those muscles either. So just doing that, though, helps activate those inside pelvic floor muscles. And sitting does make it a little bit easier to feel that contact. The other way to get those muscles to work, to really know what they're doing, let everything kind of go, just let it go, and then very gently pull back in. So sometimes you do need to kind of let it go before you can feel that pull back. Now, to get those pelvic floor muscles to activate, you want to think about pulling in and up. Now, usually when I say that, I see this. So you don't want to do that. You really want to focus on that inside portion. So sometimes I'll see people do eyebrows too, and that's okay, but you don't want the other muscles to work. So right now I'm actually doing a pelvic floor contraction, and hopefully you can't tell. The way you can tell, though, is if this is going to look a little funny, so probably do this at home, not in the office, but if you find that sit bone, and you can do this standing, and then go inside, so medial, a little bit inside from that sit bone, and then squeeze. Oh, you should feel, ooh, there's something popping right into my fingers. The other thing you can do is in the perineum, which again, probably do this in comfort of your own home. When you're squeezing, you can feel that little contraction. So that way you know that you're actually squeezing. Now, these muscles work best by actually not working as hard as they possibly can. Once you do that, you're recruiting other muscles, and then you're actually sometimes causing a downward pressure, which is the exact opposite of what we want. So it's a gentle little squeeze. You should be able to breathe and talk. And it's really no more than 10-second hold. And you may not be there yet, and that's totally okay. So you're going to hold, try to breathe at the same time, and see how long you can hold for. It may only be 3 seconds. If that's the case, you're going to start out with 10 repetitions of 3. Now again, sometimes it's easier to do it in sitting, because you can almost feel that biofeedback, that feedback of the seat and pulling away from it. But you're fighting gravity less if you're on your back. So it's okay to totally lie down on your back to start these. And a lot of times people do find that is an easy way to begin. So that's it. That's all you want to start with, because as soon as you start adding fancy fun moves like even squats or planks, the other muscles are working so hard that they're causing a significant downward pressure in those pelvic floor muscles, and then again, you're doing exactly the opposite. So just like you have to walk generally before you learn how to run, you have to strengthen up these muscles first before you get them to do anything fun and wild and crazy. So that's your starting homework. And if you do these, you should be able to start to hold for even longer periods of time. And don't forget to let them relax too. All right, thank you so much for tuning in. Get to work on your Kegels, and I will see you next time.